Hello, my name's Brian Flynn, and I'm going to be verbalizing my way through a newborn assessment today. So, to start off with, we're going to hope that our baby's quiet and potentially sleeping so we can auscultate heart sounds, lung sounds, and bowel sounds. To auscultate the heart, we're going to listen on the left sternal border, and we're going to count for a minute straight, hoping that the heart rate is between 130 and 160. If we notice that the heart sounds are on the right sternal border, we're going to document that and report that to the physician. Moving on to the lung sounds, we're going to listen on the side chest walls for any adventitious lung sounds, and for bowel sounds they could be hypo or hyperactive, and we're going to listen in all quadrants there. Now, starting from the head to the toes, top to bottom, the head, we're going to be looking for any raised fontanelles. We're going to check the anterior and posterior fontanelle, noting any raising there. We're going to be assessing the suture line down the middle, noting that if there's any separation or overlapping, which is normal. We're also going to be assessing for any fluid or kaput anywhere around the head, molding or the shape of the head, as well as any hematoma that we notice, which could indicate trauma. Moving down towards the face, we're going to assess the eyes. We're going to make sure that the eyes are actually there. We're also going to check that they're in the relative location they should be, which should be kind of in line with the pinna of the ear. Speaking of the ears, we're just going to check that their proportional size is normal and that they're not kind of drooping, and I guess that there's no skin tags, which could indicate renal issues. Moving on to the nose, we're just going to make sure that the nasal passages are patent by kind of putting our finger here and feeling for any breath coming through both sides. Moving on to the mouth, we're going to assess the soft palate. We're going to put a gloved finger in and just feel that the soft palate is intact back here. While we're doing that, we're simultaneously going to check the sucking reflex, hope that it's strong. And we're going to check the rooting reflex by just rubbing a finger kind of along by the mouth here and hope that the baby roots for that finger. Moving on to the neck, we're just going to assess for any bruising we may notice, hematoma there. Moving on to the body, we've already assessed the abdomen for bowel sounds. So we're going to check the umbilical cord. We're going to check the size of it, whether it's too small or too large. We're also going to check that there's 3 vessels present, 2 arteries and 1 vein. We're going to assess that the nipples are where they should be relative to the chest, that they're parallel, and that they're not drooping, which could indicate an issue. Moving down the arms, we're going to check bilateral brachial pulses, just make sure that they're present, and then we will check grip strength in both hands. Moving down further towards the genitalia, whether it be a male or a female, we're going to make sure that the parts that need to be there are there. If it is a male, we're going to palpate both testes softly just to make sure that they've both descended. We're also going to assess that the anus is present and that it's patent. Moving on from there, we're going to assess for any hip dysplasia, and by doing this, we're going to do 2 maneuvers, which I forgot their name. One's Barlow maneuver, Ortolani. So we're going to have the baby on its back, and we will grab the legs and push in towards the abdomen first, noting for any popping or cracking, which we don't want to hear. And then we will move laterally outwards from that position for the other maneuver, also noting for any popping or cracking, which we don't want to hear. All right. Moving down from there, we'll assess the feet. We'll make sure that all 10 toes are present. Forgot to mention, we'll also assess earlier that all 10 fingers are present. We'll be assessing for any webbing in between the fingers and toes as well. While we're on the feet, we're going to assess for Babinski's reflex just by brushing our hand up the foot and then hoping that the toes fan out. Flipping the baby over on the back, we are going to be assessing the spine all the way down, checking for spina bifida. We're going to check for the dimple at the lower back, and think that's it. Throughout this whole assessment, we'd obviously be assessing the skin. We'd be checking for birthmarks, Mongolian spots, any signs of trauma or hematoma, also jaundice for potential liver failure. And last thing I forgot to mention was we would also pick the baby up probably before we were going to do our back assessment and just notice if there's any head lag, which is what we want. If their head is rigid and stays up when we pick up the baby, that would indicate a hypertonic state, which could be from the mother using drugs during pregnancy. Lastly, we will just check the startle reflex by either softly dropping the baby down and hoping for that startle, or bumping the crib while we're standing next to it. And I think that covers the whole assessment. So we will see you Monday. Thanks.